Welcome to In a Heartbeat. I'm Liz Aiken. You know, the show comes to you from the studios at the War Memorial in Grosse Pointe Farms, Michigan. This is WMTV you are watching. All right, you know what? Actually, the premise of this show started almost a year ago with Dr. Quresh Khairullah, who is a nephrology. He's with the Clair Specialty Physicians group, which is on Morris Road in the part of the St. John Health System, right on Morris Road. Now, he and I talked about kidneys. We reviewed the stages of kidney disease. We talked about dialysis in the hospital, in a center, at home. We talked about peritoneal dialysis through the belly. We talked about hemodialysis through some form of shunt through the arm, through the blood directly. We covered these things. There was one thing we knew we would talk about at some point, and this is a fascinating thing and can make a huge difference in your life and the quality of your life, and really know what the control of your life if you are a patient who is looking at hemodialysis. We have a patient of Dr. Khairullah's here, Asie Morris, Mr. Asie Morris. He is on hemodialysis at home. This is fascinating to see how he does this, and really, literally, as I said, the difference in his life is amazing. So, Asie Morris, thank you so much.
Thank you
For being here. This is great, Dr. Khairullah.
Liz?
Always. Always good. Okay, let's start before we talk about the machine, and this is really a demo machine, and I want to say thanks to Dan Palmer from NxStage, the company that creates the machine. So we're beholden to him for bringing this to us. Dr. Khairullah, let's just really quickly go over what goes on with the kidney that takes one to some form of dialysis, whatever the form is.
Thank you, Liz. You know, we started this off a year ago.
Yes.
Maybe, you know, since then things have changed. You've grown younger, I've grown a beard.
I knew this would be fun. Thank you, by the way.
And then we talked about chronic kidney disease at that time, and I was telling you all about chronic kidney disease, if I remember correctly. And so, continuing on that discussion, I wanted to bring to this forefront this issue about dialysis as a bridge to transplantation. We had a show about transplantation,
right,
I believe, sometime.
Mm-hmm.
And for those who have to undergo dialysis for so many reasons, there are options, fortunately. And the options are mainly kind of divided into the dialysis which can be done at a center, which may or may not be close to their homes, or it can be done at home. So the center dialysis, a lot of people are familiar with that, where they have to, what we call hemodialysis is done at a facility which is near their home or not in some cases. And they have to go there 3 times a week, sit on a chair, and then come back home. And really in that case, it's not really like your own kidney working, because your own kidney, as everybody knows, works around the clock here. That's what nature has given us. So intuitively you think that you're getting cleaning of your blood 3 times a week, which may not be adequate here. Besides the fact that you go to travel over there and sit in the chair and let somebody else do your treatment here, and I'll come to that in a minute here. As opposed to that, there is a modality called home dialysis. Why is it called home? Because you can do it at home. It's not for everyone. There are certain limitations to that, but for many people it can be successful. That's why we have this show here. So that is divided into peritoneal dialysis, which you just mentioned, which is a way you can do it through yourself, and a tube is put in your stomach and you can do the exchange at home.
It goes like into the abdomen.
In the abdomen.
And so the different linings actually work as the filters.
The inside of the tummy works like a kidney. And that is called peritoneal dialysis, but for many people you can call it stomach dialysis. And that can also be done at home. And the supplies come to you at home. As opposed to that, maybe down the road, this equipment which came out where people can actually do dialysis, the hemodialysis at home. And that also is more like your own kidney in a sense, because it's done on a daily basis and you can do it at your convenience, and it's a short treatment.
All right, and that really takes us right to you, because this is a comment you made before about, we were talking about the frequency of when you do it, how often you do it, how long the treatments are. And we'll get to the whole process, but you said that because you do it more frequently, that your dietary restrictions are?
0.
Okay.
I have no dietary restrictions.
That is amazing. And you said when you go into a hospital,
I have to argue with the nursing staff to tell them that I'm on a regular diet, because they don't believe me. Then they look at my lab work and perhaps maybe get in touch with Dr. Khairullah or the other doctor that's on the floor and ask them, and they tell them, I have to tell them to give me what I want, because they don't, most dialysis patients, well, no dialysis patients unless they're on restrictive diet. I eat what I want when I want. Yeah.
And that's because you are doing it on a regular basis.
Correct.
Okay, so tell me, Mr. Morris, when you're doing this, what is the process like for you? Well, actually, let's back it up a bit. How did you come to be doing this at home, and when did you start this?
Well, I did research on dialysis when I found out that I had my kidneys were failing with FSGS, and I wanted to know the treatment that would allow me to have the most, the closest lifestyle as being normal as possible. And I came up with the NxStage machine. I learned I do love food. I mean, a lot of us do.
Right.
And I read the accounts of people who talked about the simplicity of the machine and the freedom of the diet. You can travel with it. So that's when when it finally came to the point of me needing a fistula, I told Dr. Khairullah that I'm going on the NxStage if I do indeed have to go on dialysis. So I never went in center. Didn't want to. It was just an unattractive thought to me to have to go there and sit in the chair. It seems cold and impersonal, and this just seemed like what would be right for me.
So 2 things right there are just amazing. Number one, you have no dietary restrictions at all, or fluid restrictions, and the other thing is you can travel.
Yes.
Because somebody who is on dialysis, if they're going to travel, then they must arrange a hold, and that could be a huge thing that by that point they'd say, forget it, I'm not going anywhere. So
they can, but it's not easy
not easy.
Have it anywhere you like.
Right, and then the familiarity and all of that. So you actually, this is incredible. I never even thought about that.
And NxStage
freedom.